We also have another partner in this, and these are the companies that help to support with the products and the range of materials and devices. What do you think, in today's world there's a lot of competition, but what are your thoughts if you were to come to a company and you say, okay, how are you going to remain a leader in the field? What would you tell them?
Well, I think that similar to what we see from Dentsply and Astra over these years, I think that great service is always going to be there. Especially for referring dentists who are still early in their beginning phases where they need you more. They need the referring that's starting, the young dentists coming out, starting to practice. They need that help. They need the reps to be able to go in, good reps that will be there for them and help them out. And that's true surgically or restoratively, both. Those are very important. We need quality. We need evidence base. And I'm often asked, well, what about these cheaper implants? Why don't you use these cheaper implants? How come you're only using these, top name implant like this? I said, well, I'm the end of the road, as you are, as you know, Clark. And so patients are coming to us for the most proven, most researched, evidence-based. I want to make sure that it's not me that did something wrong. I want to make sure that, that it's the patient at risk, because I know my ability, and if I know the implant that I'm working with, because it's been researched well, I know that then the variable becomes more the patient and the wound healing of the patient. I won't second guess myself. I know the company's track record. I know what I've been able to do with that implant, and I know what I can attain on 95% of my population. So that's a very important point. Whereas some of these companies, the FDA is not doing their job right now. Any titanium implant, people don't realize this, but any titanium implant, we could form our own implant in 90 days. And just make it so that at least it doesn't break under a certain amount of pressure, and you can get the implant to be sold. And so what happens is that you can create anything you want in your backyard and just make sure it's strong enough to withstand a certain amount of force, and you're okay. So what I see happening here is that there is a movement, of course, people who just care about, it's FDA approved, I'll buy it, it's cheap, They don't know if something fails, they're not sure whether or not it's the implant or whether or not it's their skills or the patient. And I want to make sure that that's registered. Plus, of course, the quality of the backup of the people supporting everything. Sure. And I think that really makes a big go.
So we've had, I think, a very good second conversation.
Yeah, it's been great.
In this time. And both of you and I have had time in front of large audiences, and I will be the first to admit I'm terrified every time I get up in front. Anyone who tells you they're not a little bit nervous, they're lying. But what are your thoughts, one thought of what you hear from the audience as one of the key things that they ask you today?
I think predictability.
Predictability
of what we're showing. Is it just my best case that I'm showing? And that's always what tends to be up on the lecture circuit. But the people who are comfortable with themselves and who have established themselves in our circles, they can be comfortable saying, let me show you my failure. Yeah. Let me show you what didn't work and why I am where I am today, whether it be the implant or a technique or a graft material. And so you get to the evolved point where you're able to say, that's why I am where I am today.
Exactly.
And they want to know that that's an honest thing. People love the fact when I show them some of my original failures of stuff that I thought would work, and why I changed my incision design, why I changed the implant, why I changed the crown that I did, the abutment that I did, when I put it in. All of that becomes very important. And I think that honesty is what makes a great teacher and what is really being asked by most people. These will change. All the implants will change. Hopefully 20 years from now, we'll both be around and we'll talk about it. Hey, remember when we used to talk about blades or this or that, or whatever, we used to talk about the implant designs. The bottom line is that it comes back to honesty and evidence base. Do what you know works best for the patient. It's a percentage game, and we know by our literature knowledge and our clinical background what is the best percentage of success.
Well, Dr. Tarnow, we've covered a lot of space here in the last few minutes. We've talked about a lot of key issues, but I think it's also the fact that we have a lot of good partners, and in this particular case, it's really because it's our patients at the end of the day that is most important and benefits from the artist as well as the tools that we're given. The tools that we're given as a part of the artistry of what we do in healthcare. I want to thank you very much for your time today.
Thank you so much. It's been a real honor to be with you.
Thank you.